Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a Dr. Vinay Kumar Swami. He's not just an ordinary orthopedic surgeon. He is also trained for the sports injury. He is trained for the robotic surgery, and he is also a marathon runner himself. And he knows how to protect the knees and the injuries and everything. So today he is here to tell us about the robotic surgery for the knee replacement. Welcome, Dr. Vinay.
Thank you, madam. Glad to
Nam-
be on your show. I thank you for the opportunity to share my views with your listeners.
Yeah, thank you. Now, please tell us what is the indication for the robotic surgery? Which are the patients who are get benefited by this?
So, all patients with stage 4 arthritis in the knee are ideal candidates for knee replacement. Any patient who requires a regular knee replacement is also a candidate for a robotic knee replacement. There is no specific indication for this is the case where you can do only normal replacement, and these are the only cases where you can do a robotic knee replacement. All candidates who are good candidates for a normal knee replacement can undergo a robotic knee replacement also.
So that means you give the choice to the patients whether you want this or not. So, what
Correct.
are the advantages of robotic knee replacement over the ordinary knee replacement?
A robotic knee replacement means there is a robotic arm which, under the patient surgeon's control, does the bone cuts. What does the bone cut mean? This is a model of our knee joint. When the smooth covering of the joint, which is called the cartilage, wears off, that is called as arthritis. When the knee has gone into stage 4 arthritis, we do a replacement. What we do is we cut certain parts of the bone and replace that with an artificial component. There are normally three artificial components of a knee replacement: the thigh bone component, the leg bone component, and the ultra high molecular weight polyethylene. When I have to put these components, I have to cut the bone. So the does the cuts for me, and I control the cuts. So I open the knee and give it to the robo. The robo does the cuts. Then I put the cement and I put the implants onto the surface. So these bone cuts are very important and they have to be very accurate. So the accuracy of bone cuts is better with a robotic knee replacement because we have done a preoperative CT in most of the cases, and that data will be fed into the robo. So the robo can see the whole knee in 3 dimension and do a slightly better job, and the complication rates are a little less with a robotic knee replacement.
Okay. So you are a young man and your hands are very steady. Someone who is old like me and then hands are not steady and they have tremors or by some chance, they go to the wrong. Can it be corrected by the robo R?
Yeah, the robot does not allow you to do mistakes. It has been coded in such a way. There is something called as a haptic feedback. There is a haptic boundary that the robot has, and it will not allow the surgeon to go beyond that boundary. When I am doing a bone cut, I am standing in front of the knee joint and I'm cutting from the front going to the back. The back has a lot of important blood vessels. So if I am cutting
Ah,
from the front, I don't know how much depth I'm going to because I can't
okay.
see what is happening at the back. Whereas the
Okay.
robo has a haptic boundary which will
Hmm.
prevent me from going deep towards the dangerous structures, which are the nerves and the vessels. So that
Oh.
way, knee replacement becomes even more safer with the haptic boundaries that the robo defines.
So the complications are less, and then the what to say that the mistakes are also less, and so it is more precise and accurate, and that's what
Correct.
you are saying. Now, for having got this accuracy and the benefit of the precise treatment, either the cost or over the regular replacement, what is the
Definitely.
extra cost that one has to bear?
Yeah, so there is a cost involved with the robotic knee replacement because the robo is quite expensive, and we have to
Hmm.
use additional disposable instruments for the robo also. So the cost
Okay.
goes up by nearly 1 lakh rupees for every knee replacement.
Hmm.
So the normal rate is around 3 to 3.5 lakhs for one knee replacement. It goes up by one more lakh if we are using a robotic knee replacement.
Okay, okay. But what is the benefit? How much benefit they get for having spent 1 lakh more?
Yeah. So the benefits are in two ways. One is an immediate benefit and one is the long-term benefit. Ultimately, when we do a knee replacement, you want it to last longer. If you do your surgery more accurately, then the same knee replacement will last longer. Normally, we say a knee replacement will last for 15 to 20 years. So if you do it more accurately, then it may last for 25 years or even 30 years. So the
Okay.
longevity of the implant increases. That is the long-term benefit. The short-term benefit is if we do the surgery more accurately, the pain will be less, the rehabilitation will be faster. People who are working can get back to their work faster. That way, they can earn the same money back, and they spend less money on physiotherapy if they recover faster. That those are the immediate benefits of the surgery.
Okay, okay. So, in other words, you are saying that ಕಾಸಿಗೆ ತಕ್ಕಂತೆ ಕಜ್ಜಾಯ. For having spent the money, they are getting the benefit also.
Definitely,
So,
definitely.
ultimately, to our viewers, what is the suggestion that you would like to give, or the what to say, like advice that you would like to give them?
So, robotic knee replacement is new and it is definitely worth the expenditure that is involved in robotic knee replacement. However, I would also like to say that I do a lot of robotic knee replacements. I do a lot of conventional knee replacements also. If you want to compare the benefits of a robotic versus a conventional knee replacement, robotic knee replacement is around 5% better than a conventional knee replacement. If a patient has stage 4 arthritis, I do a normal knee replacement. They also become much better very quickly. Compared to that, robotic is slightly more better. So if there is a cost constraint, someone is in a tier 2 city, tier 3 city where there are no robos, they also can undergo a normal knee replacement, or if there is a cost constraint, they can undergo a normal knee replacement. But if cost is not a constraint and there's an availability of a robo, then it's better to go for a robotic knee replacement, which is more accurate.
Yeah. And so if it is 4 to 5 lakhs, anyway, even the poor can afford it because they have the Ayushman Bharat from the central government where 5
True,
lakhs are
true,
given.
true,
So
true,
when
true.
the money is given by the central government, they can as well get the best benefit and the best
True, true,
technology, and even the poor can afford it. It is not that
true,
haves, even the have-nots can have it. I think
true,
what is
true.
important is the mobility so that, they come back to the normal life or the better life, better quality of life, and they can lead a fruitful life, and that's more important. So thank you
Absolutely.
very much for giving the so much of information and telling the suggestion. Thank you so much.
Thank you very much, madam. Thank you. Have a good day. Thank you.
Okay, thank you.